I talk about expectations every day in my practice. I tell the patients, okay, my goal is to make you a satisfied patient or customer, skincare client, whatever. I want you to be happy. I want this to be a mutually beneficial win-win relationship. I got to do two things. One is I've got to do the procedure well, but the second thing I've got to do is I've got to manage expectations. If you came in and you wanted, God forbid, a Michael Jackson nose, and I thought you really wanted a decent looking nose, I could do a decent looking nose, but if you wanted something weird looking, you wouldn't be happy because that's not what you asked me to do. And so what we do is we really spend a lot of time on expectations. I've got to know what the patients want to do. Whether that's a breast augmentation, I want photographs. I want to see what they think looks good. It's like that old cartoon, you know, where the patient's telling me one thing and it's showing what they're trying to describe with this balloon over their head, and I'm picturing something else and it's totally different. That's one of the reasons we use computer-enhanced technology for rhinoplasties. They can tell me what they want to change in their nose. I can put it on Photoshop, change that the way I think it looks, and they can go, yes, that's exactly what I want, but I'd actually like that. I was thinking that tipped me up a little bit. So I tell them that's no guarantee, but at least we've got the same picture in that cloud above our heads when we start. Otherwise, we don't have a shot at it. So expectations are great, and one of the things is, how do you handle unrealistic expectations? Well, I deal with it head on. I'm not doing them any favor by telling them what they want to hear. If they're asking for something that's unreasonable, you know, I've raised 2 kids. I have a little experience in conflict resolution, and so I have to actually come to them and say, you know what, I know why you're asking that, because it sounds good. You've heard something on TV that seems like it ought to work great, and there's no downtime, and you're going to look fantastic. But typically, things that sound too good to be true turn out to be too good to be true. And so if they are great, we'll have them here and we'll utilize them. But if they don't, I'm going to explain to them. I'm not going to just say, no, it won't work. I'm going to tell them why it doesn't work, so that they leave here with not only, they may be disappointed, but they'll understand, and they'll leave with knowledge and a comfort that at least they don't want to miss anything. They don't want to, if they're doing something with their face or whatever it is to enhance themselves, they want to make sure that there's not an easier way. You can't blame people for asking about that. The aesthetic industry is a very competitive market, and there's a lot of things out there that just aren't true. And there's marketing, and you've got to, my job in managing people's expectations is to tell them about great procedures and also separate those procedures from the hype.